Hello, I am Dr. Ashwati Nair, Clinical Director at Nova IVF Fertility Clinics, Delhi NCR. Today I am here to discuss factors on which the success of an IVF program depends. So one of the most important factors on which the success of an IVF program depends is the age at which the IVF treatment is taken, especially the woman's age. As we all understand, as a woman ages, both her egg numbers and the quality of egg declines. So, one of the most important determinant of success of an IVF program is the woman's age. Not that a man's age matters, but usually the semen parameters remain almost the same till they attain an age of 50 years. And chromosomal aneuploidies happen in males after the age of 50 years. Now coming to the second most important factor, that is about the ovarian reserve. Now when we talk about ovarian reserve, we have to understand there are two parameters that we are looking at. One is the anti-Mullerian hormone levels and the other is the antral follicle count or the egg count actually present in the ovary. So it is logical to say that if we have good number of eggs retrieved, we have chances at forming more number of embryos, and therefore the cumulative outcome or cumulative pregnancy rate in an IVF cycle would definitely go up. The third important thing is the uterine health. Now, uterine health becomes very important because uterus is the seat of implantation. Now, when we talk about uterus, presence of conditions like fibroids, adenomyosis and polyps can impair the implantation rate of an embryo. Also, there are certain conditions like endometriosis and polycystic ovarian syndrome where the receptivity of the uterus can go for a toss, and this again can decrease the implantation rates. So nowadays we have latest technology like endometrial receptivity array by which we can identify the time of embryo transfer and do a personalized embryo transfer for a couple and achieve implantation in such women. Now when we talk about the success rate, males also contribute equally to a successful IVF program. So the sperm count, the sperm motility, the morphology of the sperm, and nowadays recent tests like DNA fragmentation index and correction of DNA fragmentation index if it is deranged can also improvise upon the success rate of an IVF program. Now there are other things which are usually ignored. So a patient usually believes that IVF is all about medications, injections, eggs and sperm. One thing that is usually left out is lifestyle. Now, it goes without saying that a regulated lifestyle is a very important part of a successful IVF program. Eat on time, sleep on time, take a well-nourished balanced diet, and this goes true for both man and woman. A regular exercise routine, at least 30 to 45 minutes of moderate intensity regular exercise can improvise the success rate a lot. Also, nowadays, we see that both men and women take alcohol and smoke on a regular basis. All this can have a detrimental effect on the success rate of IVF. So when we talk about a success rate of an IVF program, it has to be a holistic approach. And last but not the least, and I think it is one of the most important factor, is the lab or the lab environment where your embryos and gametes are going to be cultured and ICSI would be done. Of course, the skill of the embryologist plays a very important role here. Also, the quality control and the standards that are maintained in the lab goes a long way in assuring a good success rate in giving in an IVF program. So, when you choose an IVF clinic, choose it in terms of the lab's success rates and results and innovativeness also. So, these are certain things that can be looked upon when you talk about the success rate of an IVF. And cumulatively, I think, at least 60 to 65% of the couples who undergo IVF can easily attain a pregnancy in a single IVF program if it is done correctly and meticulously, and all the above factors are taken into account.